Great, thank you. I appreciate everybody being here with us, most of you in the comfort of your own home. My name is Brad Holland. I'm the President and CEO of Hendricks Health System. Today we face an unprecedented time in our community and in our nation. And I'm proud to be surrounded here in Abilene by an incredible community as well as a medical staff and care providers. With me today to my left is Mike Murphy, CEO of Abilene Regional Medical Center. And to my right is Dr. Wiley, a local pediatrician, as well as the Chief Medical Officer here at Hendricks Medical Center. Today we've called together what we call a medical press conference because we recognize that there's a lot of uncertainty in the community and a lot of questions that people want to know about our preparedness in the community, as well as the risk to the average person, as well as what your local hospitals and caregivers are doing to prepare for today's unprecedented times. First of all, I'd like to thank the community and the school district, the public leaders throughout the community for the outcry of support that each of us have recognized and benefited from. We know that we hear this thing about calling smooth the curve or blunt the curve or of the coronavirus outbreak because we know if it spikes, it overruns the healthcare providers. And we know that has created hardships on every one of those local businesses here. We don't take that lightly. We recognize that is a difficult position to be in. For that, we want to say thank you because we know that you're doing it for us and the caregivers. One, we know you will save lives, but also it will help the healthcare system to be and remain viable in these difficult times. We also get asked what the community can do to support any of our caregivers. I would say, first of all, prayers. I think that you look at our community and such a faith-based hospital that Hendricks is, but you look at the community and the churches and each of your own individual faith. I just ask for your prayers for our community and our nation, our leaders and the decisions they make, as well as our healthcare providers and frontline staff. Secondly, one of the things that we talk about and others may want to discuss is personal protective equipment. I believe at the onset after this discussion on the Hendricks website, one of the things that we're going to do is put a pattern together that if any local businesses or individuals want to put together a personal protective mask or PPE, we will put out a template that anybody can reproduce that meets the standard of care that we would like to uphold in both of our organizations. With that being said, again, I'd like to welcome everybody. I just wanted to make a few of those opening comments. At Hendricks Health System, I just kind of want to talk about some of the things that we're doing on a local level as well as a national level. And then I'll ask my colleagues to my left and to my right to also be able to address what they're doing in their institutions. Dr. Wiley is recognized or representing some of the medical staff with us today, not only the hospital, but recognizing he will also be introducing several medical staff members, leaders in our community that also will represent a diverse group of physicians through the community. And Mike Murphy, a friend of mine for many years, and I are going to work very closely and mirror each other's readiness and preparedness, and really appreciate Mike's friendship during this period of time. First of all, both organizations have limited and restricted visitation into the hospitals. We've done that to keep our hospitals and our caregivers safe and reduce traffic into the organization because it is part of social distancing, but less traffic means a cleaner environment, and that's what we're going to continue to enforce, which is a state mandate. That's not anything that Hendricks created in a vacuum. That's not anything that Abilene Regional created in a vacuum. But unless a loved one is deteriorating or end-of-life care, we will restrict visitation in accordance with state guidelines. Another new development as of today and yesterday, both hospitals canceled elective surgeries. That does not mean that if you have an urgent or life-threatening or medically necessary case, you will still be able to have those cases. But to preserve PPE or personal protective equipment, those cases, again, have been declared by the government to cease and desist elective cases. Those cases, once any moratorium is lifted, we will be able to provide those services once again in the near future. But at this point, we have canceled elective cases. But again, if you have an urgent or necessary medical need, those will continue. A couple other items at Hendrick I'd like to discuss is this, what I call our continuum wheel, one of our community solutions, which is very similar to the equivalent of the drive-through solution that you hear in many communities. You hear drive-through testing. Well, at Hendrick, we don't have drive-through testing. We have something what we describe as a bit more innovative. We have what we have this continuum of care wheel. So what we ask people to do is text COVID help to 325-216-4824 to begin the screening tool. So instead of getting in your car and standing and driving in line, in the comfort of your own home, you text this number. It will go through a screening process, and if you're determined at high risk, you will be directed to a 24/7 call center that Hendrick is staffing. And then if it is determined that you are high risk, they will actually send you with the physician order to a screening clinic where you may be seen in person. If you are determined, again, to be low risk at that point in time, you will be provided physician education as well as CDC guidance on how to go home and self-quarantine. But we will also screen you for flu and strep as a potential rule-out solution. And if you need to go home and self-quarantine, you will do that. But if on the extreme measure that you need to be admitted to a hospital, Hendrick is designated a designated COVID-19 inpatient unit for your care. So that's what I describe as our solution, our community solution that Hendrick is putting together. I understand that Abilene Regional, working with the Abilene Diagnostic Clinic, may have their own solution. And I'd like for John Cole at a later time to be able to talk about that solution. But I did want to highlight what we're doing here at Hendrick. In addition to that, I just wanted to talk about some cool innovations. I've been doing this for over 20 years, and I can tell you that I've never seen innovation like what we're seeing. I do appreciate the red tape that has been cut on the local levels and the federal level. Here at Hendrick, we've started some really cool items, and I'll just talk to you about a couple of those. Number one, we've started telehealth. If you have a relationship with a Hendrick Provider Network physician and a Follow My Health app, you can schedule an online televisit with your provider if the two of you agree that that is the best way to proceed, and that is effective today. In addition to that, on a designated inpatient unit, we have virtual visits where you can be in contact with your loved one or a physician in the hospital without making contact. That saves PPE, that reduces caregiver exposure, but it still allows the physicians to make virtual rounds. In the event a physician needs self-quarantine and home quarantine, they can still round at home because of the virtual visits, and that's something that we've never been able to offer before. And then last of all, one of the items that I'm really excited about is working with local school districts, their robotics departments in the AISD and the Wiley School District. We came together in a day or two, and those departments created a rolling robotic patient over bed table delivery system. So we can deliver medications. We can also potentially put a GoPro on it, do virtual visits to your loved ones, but also reduce exposure to our caregivers and save that PPE. So in this time of uncertainty, I'm really appreciative of the care and the innovation and the support from the community. And with that being said, I'd like to turn it over to Mike Murphy to make any comments. But again, I'd like to recognize that Mike and I are working very closely, and the resources available to Hendrick are available to Abilene Regional, and I feel confident that it's vice versa. Mike, anything to add?
Yeah, thank you, Brad. And I think you've summed it up pretty pretty well. I do appreciate the opportunity to be here, and at a broader level, the opportunity to work together collaboratively with Hendricks Medical Center. I think everyone in Abilene, everyone in the viewing area, everyone in the big country benefits from having two good acute care hospitals working together in times like this. As Brad noted, there are hardships, and some of those things that we're doing. You know, I have 3 sons home from college right now, so you know they're not able to go to college, and so there are hardships at the family level, at the local level, and in the hospital, as we now take measures to protect our workforce for the surge that we know is coming. We know there will be a surge at some point in the near term. So the things like dramatically reducing the visitation to patients in the hospital, the access points to the hospital. Both hospitals have many doors that did provide entrance and don't anymore. And so there are a variety of restrictive measures that we've done to protect our workforce and to preserve the PPE, the personal protective equipment that we're going to need. We're going to run out if we don't preserve it now. And so, not to sound like an alarmist, but there's a real surge coming. We just don't know exactly when that is. And so we've taken these measures. But as Brad has noted a number of times in a number of different venues, you know, the keys for everybody are to practice social distance, no more handshakes, stay 6 feet apart. You can see that we're spread out here even on the stage. Avoid large groups. Groups of 10 or less are permitted. And shelter at home. And really, we're not equipped, we're not set up to test everybody in the community. There aren't enough tests around, and that's not unique to Abilene. You've heard that in the news probably. So the point is not to test, but to go through a screening process. As Brad noted, we are working with Abilene Diagnostic Clinic on a process that will involve a telephone number to call in. It doesn't mean you get a test, it means you get screened. The CDC recommended questions, you get screened, and then maybe you're told to stay shelter at home, maybe you're instructed to go to a site for testing, as Brad had noted. And really, I just want to kind of end cap it there. Dr. John Cole is our Chief of Staff at Abilene Regional, and he's going to talk a little bit in a minute as well, but that kind of is a summary of the things that are going on. And again, Brad, I appreciate the opportunity to be here.
Thank you, Mike. Dr. Lowry and others will join us here shortly, but at this point I'd like to turn it over to our Chief Medical Officer, Dr. Rob Wiley. Dr. Wiley?
Very good. I would like to welcome everybody. We are practicing the 10-person rule mandate from our governor. There are 10 people, actually only 8 people in the room, and we have taken every effort to make sure we are spread out by 6 feet and responding to that. I know you keep hearing words about collaboration. That is key. That is what we're seeing in our community at a level that is remarkable. The collaboration that's occurring between Abilene Regional and Hendricks, working as a team, working with our school districts, working with our churches, working at every level. This has become a community project. It's become a regional project. It has been amazing in what we are doing. You know, from a physician standpoint, I will be introducing the Chief of Staff from Hendricks and also from Abilene Regional. But from a physician standpoint, our goal is to stay ahead of this wave. We are working hard to stay above this, ahead of this wave, and to make this into more of a white cap. We're trying to flatten the curve. We're trying to avoid that tsunami. How are we doing that? Well, I think a couple of ways. One is we are defining what is essential. What do we need to do to be able to provide adequate care for our community and protect ourselves? And we are defining what non-essentials are. And those non-essentials are difficult at times to define. There are 2 areas we're looking at specifically. We're looking at capacity. How many patients can we take care of at one time? What can our community do to take care of our families and take care of everybody? And the other area we're looking at is capability. What does it take for us to do what we need to be able to do and to do appropriate level of care? From a capacity standpoint, we have looked at our procedures, our surgeries, our elective, our urgent, and our emergent cases. And I'm going to let Dr. Cole and Dr. Lowry speak about that in a minute. We're also looking and working with our regional hospitals. We are providing services to the regional hospitals with consulting physicians. We're trying to be efficient and use our resources wisely, helping the communities be able to manage patients that they can at their hospitals, transferring to a higher level when we need to, that ongoing communication. We're also looking through our emergency room under the leadership of Andy Russell. Dr. Russell is our medical director. He is looking at and working with his physicians who are very involved in this process of how to get patients that are acutely into our ER and also to refer them to the places they need to be, whether it's to the screening process that we're talking about at this point, to local clinics. Our goal is to have the beds available within our hospital. We're also looking at what are non-essential services that we offer through our community, through our hospitals, and those are going to be suspended until the essentials are taken care of. The other big thing I think that Hendrick has been very focused on with our physicians is identifying available beds, and this is occurring at Hendrick and at Abilene Regional. We are looking for bed space throughout our facilities and also outside our facilities, wherever that may be. The other part I mentioned was capability. Capability. What do you need to be able to do your job? What resources? What skills? Some of the skills we're looking at, and I think we will hear more than you can imagine about PPE, personal and protective gear, and that being gloves, masks, gowns. We've got a task force that we put together that's monitoring the use of this. They're sourcing it. We are looking for every possible avenue for any of these things. I think Mr. Holland mentioned the resource that will come online where you can be a part of that. We've had several churches and community groups contact us saying, what can we do? And that's a huge asset to us, is to have more masks for everybody to be able to wear. We're also looking at what essential equipments do we need and how many we have of those and what are those resources and where are we going to have them. For example, oxygen delivery devices, ventilators, our ICU beds, testing capabilities. I will let Julia and Annette Lerma with the health department discuss a little about our testing capabilities. And finally, we as physicians, we are adjusting also. We're having to reallocate what we do. There are many physicians who are surgeons who right now their schedule is clear of elective procedures, and they are opening up and offering services all over our community. I can give you an example. Dr. Jason Acevedo, he is a ear, nose, throat doctor in our town. He called me and he says, you know what I did before this? I was an Army physician. And so he says, whatever services our community needs, I want to be a part of that. Another example would be a physician who his undergrad training and his master's level work, Dr. Thompson, was in epidemiology. So he is reaching out to our health department to be a volunteer there. As you can see, there's a lot going on within the medical physician community, and our goal is to be collaborative, to be a part of the solution, to be proactive in what we're doing. So at this time, I would like to ask Dr. Stephen Lowry and Dr. John Cole to come as we dismiss our CEOs, because we want to be respectful of our 10 in a room mandate. And as they're coming up, I will tell you, we are going to have a short, brief question and answer period. So while they're being seated, you know, we get to work with two local hometown boys here. Dr. John Cole, he is our president of the Big Country County Medical Society, which is a membership of over 300 physicians. He is also our chief of staff at Abilene Regional, and he also serves as general surgeon in our community. Dr. Lowry, who is a Wiley product, which is a good thing. He is an anesthesiologist. I don't know if there's such thing as a general anesthesiologist. An anesthesiologist. He is also our chief of staff at Hendrick. He is also a driving force behind our proceduralists and what we are doing with our future. So at this point, I would like to turn this over to Dr. Cole and for him to make a few statements. Then we'll have Dr. Lau.
All right. Thanks, Rob. One of the things I want to get out to the community is we've already discussed it a little bit, is the coordinated effort between our two hospitals, the medical staffs, the health department, and also the Big Country County Medical Society. And that medical society, like Dr. Wiley said, is 300 members strong. It includes Taylor County, Jones County, Haskell, and Callahan. And you talked about some of the surrounding communities, and those physicians are involved with that and with this coordinated effort. And the two hospitals kind of mirroring each other and working in coordination. And that's been a fantastic thing to see. I have a lot of people who ask me, well, where are we right now? What's the community, or do we have any infection? And we'll talk a bit more about that. There's no positive cases as of now. So I keep telling people we're in a state of preparedness and testing. That's kind of where we are right now. And the preparedness is the thing that we're talking about today. Dr. Lowry is going to talk a little bit more about in a minute some of the surgical services that have been canceled or postponed and the reason for those. Everybody, the key term now is the PPE. We've seen in some of the other communities that have been affected by this, New York, some of the bigger cities, that's what they're running short in, is the protective equipment. And so that's what we're really hitting hard, is conserving those things and some of the recommendations, and he'll talk a bit more about that. Both hospitals have well-established infection control protocols even before this, and we've just continued to enhance that as we walk through this. Mr. Holland talked earlier about the circle here, the testing. Kind of on the south side of Abilene, Tom Headstream and Lisa Blackwell with Abilene Diagnostic Clinic really kind of took this by the reins and ran with it and started to establish some testing through Abilene Diagnostic Clinic. They are doing some of the telemedicine, the telehealth, where you can call a number, and I'll give that public number. It's 325-437-8602, and you call that number. Similar, they'll do the health screening on the phone. If they think you need to discuss further with a physician, they have telehealth, telemedicine available. And if you meet criteria, and that's the important thing, not everyone needs to be tested. You need to meet the CDC guidelines. If you meet those guidelines, they actually have a drive-up area where they can come to the car for you, do the swab, and they'll tell you if you don't need hospitalization, they'll do self-quarantine, home quarantine, and go through that. But so far, as of yesterday, they had tested 49 individuals. They have 6 results so far, which are all negative. And that's one of the other things we're seeing is the length of time it's taking to get some of the final results of the testing. And we're relying on companies that are kind of out of our hand, out of our community, that we send it to. And so, but Abilene Diagnostic and the Abilene Regional is now partnering with them, and as that testing really ramps up, we may move it over to the Abilene Regional parking area and set up an outside facility to do that. But as of right now, they are being able to contain what they need to over there. And so, from our standpoint, again, it's the cooperation, the collaboration between the hospitals, the physicians, and the community that's just been really impressive to see. Stephen, you want to talk a little bit?
Sure. Thank you guys. Thank you everybody who's out there watching. Hopefully this is informative and helping everyone to understand some of the actions that are taking place and the reason for those actions as well. Some of you have heard me say before, we need to think globally but act locally. In trying to explain that further, if you look at what's going on around the world, this has taken off over in China, spread to Europe, and now it's reached our shores. And I'm sure many people have watched the maps of confirmed cases, and the colors change. Geographically, we're in a location that I think gives us an advantage. We are not isolated, but away from the epicenter, and that gives us time to prepare, time to do things that will help mitigate the spread of the disease or infection in our community. And many of those things are already taking place. The social distancing, the prolonging of the return to schools for our kids, a lot of different steps that are uncomfortable and inconvenient, very inconvenient, but necessary have taken place. As far as what we've done, you've heard all of the people that have spoken before me talk about different things that have happened in our community, in our hospitals, and I'd just like to address at this time procedures in particular. You know, early on in March, the American College of Surgeons came out with a statement recommending delaying or postponing all elective procedures, and that was followed very shortly by the Surgeon General, who echoed their call. Here in Abilene, both hospitals have gone with this three-phased approach to implementing that, and we were all in phase one for about a week, I believe, and screening out patients that were either at risk or that met certain criteria that put them at risk for having a more severe course of disease if they were to contract the virus. This weekend, the decision was made to move to phase two, and that was a very difficult decision, but an appropriate decision. And following that decision, the governor came out with a statement that essentially put us into phase three. In his executive order, he stated that any elective procedure that was not immediately medically necessary must be canceled, postponed, and rescheduled. So what is all this about? Well, it's really about two things primarily. One is maintaining capacity to take care of individuals that will contract this virus and come into our facilities needing care. The capacity issue has been talked about by Mr. Holland, by Mr. Murphy. You've heard some of the things that have gone on in order to maintain capacity. And it's impressive the amount of planning that's gone into it and the strategies that have been developed in a very short time. In addition to that, the executive order to hold off on elective procedures is also to do just what Dr. Cole said, and that is preserve the equipment, the supplies necessary to protect ourselves and other patients in the hospital from contracting this illness and further impact our ability to care for patients that may come down with this. We believe that if you watch the map, look globally, you see that this starts small and spreads very rapidly. And in mitigating that through the measures I've already mentioned, that's to help prolong the availability of supplies to keep us all safe and keep the patients safe as well. Some of the innovations, some of the things Mr. Holland mentioned are very impressive that have come from our community and members of our community, from high school students to people volunteering to make masks and do things to help out. That's one thing that I've really been impressed with, is how our community, and it's special about Abilene and the big country, is how we work together to find a solution and try to take care of our own, take care of each other. So that's been very impressive and reassuring to see. A big part of what I've dealt with, or what I've been have the benefit of facilitating, is our medical staff, and in this process, and watching them, having them help me to try to achieve the goal that we have stated here. Some of the individuals on our medical staffs have made outstanding sacrifice through delaying, canceling procedures that their patients need significantly, but at this time have to be postponed. And they've made very difficult decisions in trying to decide who absolutely can't wait for a procedure, who they need to postpone. And those are decisions that are very difficult, but are being made by our medical staff members, and I really appreciate their working with the hospitals to determine how we can best achieve the goal of maintaining capacity and supplies. As Dr. Wiley said, we've had some different staff members come up and approach us about opportunities for them to help out, do things that they may have done in previous lives before they started their career as a surgeon or whatever the case may be, to do whatever's necessary in order to care for our community, and that has been appreciated. So just know that the medical staff members on both hospitals care deeply about their patients, our community, and are doing everything that they can to try to prepare for this and get ready for this. That's all I have to say, and at this time I'm going to turn it back over to Dr. Wiley.
So thank you, Stephen, John. I have a plea. I think you are asking as a community what is important. I can tell you right now that our community, it has a blood shortage. That to me is significant. We've talked to our ED physicians, and we have enough plasma in place for one trauma victim. And if it required a significant amount, we would deplete our supplies. It is incredibly important that if able to donate blood, the blood bank is set up with social distancing in mind. We've separated all the chairs. If you are able to do that, we would welcome that. That is a need in our community, not only for our proceduralists and for our surgeons who are only doing the emergent cases, but also for our ICU and throughout our community. So I want to transition a little to the health department, to Annette Lerma, who is the medical director or the director of our health department, and also Julia Gavo, who is our epidemiologist. These two people are providing resources, advices, recommendations to our whole community. At this point, I feel like both of them are probably going to change their cell phone number as quickly as possible. They're taking calls from everybody and anybody, and I just appreciate the service. So at this point, I will turn it over to you folks at the end of the table.
Thank you, Dr. Wiley. I would like to briefly discuss the current testing processes that are going on. Testing capacity has been a common theme when discussing the COVID-19 outbreak. This is not a problem that is unique to our area. There are many communities that are across the nation that have been struggling with limited resources in regards to testing. This is an issue that our state and federal leaders have been working tirelessly to address, and we are beginning to see improvements in terms of the amount of tests that can be performed. However, it is important to understand that there are testing criteria that is being used by the medical providers to help decide who should be tested for COVID-19. These criteria have been developed by the CDC and the Texas Department of State Health Services. Right now, there are currently two paths for testing, one through commercial labs and one through public health labs. For the commercial labs, many providers and clinics and hospitals currently have their own contracts with commercial labs of their choosing. And the CDC has advised those providers using the commercial labs to take a range of different factors into account when deciding who to test. These factors that providers might consider may include your symptoms and whether they're consistent with a lower respiratory illness. They may take into account your travel history, any close contact that you might have had with confirmed cases, your risk factors for poor health outcomes, and the current status of COVID-19 in our community. Ultimately, a medical provider will take into account these factors, and they will use their clinical judgment when deciding to test a patient. The second path involves public health labs. The Texas Department of State and Health Services have provided public health departments with very strict criteria that have to be met in order to consider sending specimens to the public health labs. This criteria can include the following people: people who have fever or symptoms of a lower respiratory illness, and they have had close contact with a lab-confirmed case of COVID-19, people who have both a fever and signs and symptoms of a low respiratory illness, and they've traveled to a high-risk area, people who have both a fever and symptoms of a lower respiratory illness, and they have risk factors that may lead to poor health outcomes. This can include people who are pregnant, those that are elderly, or those that are medically fragile. And lastly, people who have fever and signs and symptoms of a lower respiratory illness that require hospitalization and no cause of illness can be identified. At this time, the health department, along with various providers and clinics and hospitals in our community, are currently testing for COVID-19. With these testing criteria in mind, this is what the overall process may look like for someone. First, a person who is ill would call their primary care provider, clinic, or health department, depending on their unique circumstances. A medical professional will speak to you and screen you over the phone about your symptoms, your travel, your sick close contacts, and various other factors that are related to your illness. Using the testing criteria mentioned earlier, the medical professional may decide that you do not need to be tested, and they may ask you to self-isolate at home. Please follow the self-isolation guidance that's been given by the medical professional and stay home as much as possible. Using the criteria mentioned earlier, it may be decided that you do need to be tested for COVID-19. If this happens, you may be asked to present at the health department, clinic, or hospital in order to collect your swab. Once you have arrived, a swab of your nose or throat will be collected. Depending on which provider ordered the COVID-19 lab, the swab will be sent to the appropriate commercial lab or public health lab. Please note that turnaround times will vary depending on which lab the specimen was sent to you. Some labs will take 1 day, some may take up to 1 week. Once your results arrive, next steps in terms of returning back to regular activities will be discussed on a case-by-case basis. There are people who will not meet the testing criteria. It's important to understand that testing is used as a diagnostic tool. There are individuals who need testing because a diagnosis would change the medical care and treatment that they are receiving. Testing may decrease their risk of poor health outcomes. While we understand that increased testing gives us a better idea of the number of cases in our area, we should all be aware that there are individuals who may have severe illnesses that will benefit more from testing than others. Most people with COVID-19 will experience mild illness that does not require medical attention. Furthermore, there is no specific treatment or drugs for those that have mild illnesses of COVID-19. So please follow the self-isolation guidance that is given to you from your primary care provider, the CDC, and the Texas Department of State Health Services, even if you have not been tested. Please stay at home as much as possible and avoid public spaces unless it's absolutely essential. If your symptoms worsen and they become unmanageable, please do seek out medical care by calling your provider or local health care facility first. You do not have to be tested, and you don't have to know that you actually have COVID-19 to be able to practice these social distancing measures. By doing this, you are playing your part in protecting your loved ones and our community as a whole. Thank you.
Well, I just want to take a moment also to acknowledge the great collaboration that we've had with the medical community. Public health has existed. We exist to make the job of healthcare easier, and so we are doing our part to try to make that job easier on you all. But I did want to talk briefly about addressing some of the questions that we've been hearing and seeing, especially after we posted numbers yesterday. As Julia mentioned, there are two different avenues that the tests run through. They can either go through public health or the private, and those processing times vary significantly. So currently in Texas, if you look on the DSHS website, you'll see that there have been over 10,000 tests submitted. About 8,500 of those have gone through those private labs, and about 1,500 have gone through public health labs. The ones that are being submitted to the private labs are the ones that are taking a lot longer, and then the ones that are going through the public health labs, they're not as inundated, and so those are usually fairly quick turnaround times. Our public health lab is at Tarrant County. Their testing capacity is also limited though, so as it ramps up, it may start to delay a little bit. Up until yesterday, they could only accept about 20 tests per day, or they could only run about 20 tests per day. As of today, they can run up to 39, so that capacity is already increasing a little bit. We do understand that the community's frustration in seeing that 90 tests are still pending. It frustrates us too, but because we want to have a better picture of what's going on in our community. But those things, as was mentioned, are out of our control. But we know that the officials are working quickly to try to resolve that and improve capacity. The second thing I wanted to address was why we chose not to share numbers in the beginning. I know there was a lot of talk about that. As you can imagine, completely changing the way you operate your entire organization in a matter of days is a monumental challenge. At the health department, we normally operate 19 different programs and services for the residents of Abilene and the Big Country through both our main health department and our Mercy Healthcare Center. Halting many of those and retraining staff to help with the COVID-19 response and fielding a 200 to 300% increase in calls is time-consuming and has been a challenge, to say the least. Staff have stayed late into the evenings, worked weekends to prepare and strategize phased responses. Working with every part of the community, from business and schools to healthcare partners and private citizens, our main focus has been to ensure that we ourselves are educated and that we have the necessary tools and supplies we need, as well as considering our first responders, our healthcare partners, and all other community sectors' needs to protect against an impending disease outbreak. Although it wasn't our intention to appear to hide information, I understand that having inside knowledge about everything that was being done might leave people wondering why they didn't have immediate access to information. We do now have processes in place and have been able to come up for air, and we're working to communicate better with our residents. But we do still ask that you please have grace on us as we all learn a new normal. Finally, I'd like to address two apparently opposite points of view on the prevention and mitigation efforts that we've implemented so far in our community. There are some who are concerned and may feel that we should be more aggressive in social distancing, while others seem to have little concern or may view efforts as an overreaction. Although we have not yet identified the first case in Taylor County, we are making decisions assuming that it is already here. Public health's role has always been to focus on prevention and to reduce impact and the burden on our healthcare system. This has never been more important than it is right now. We have a limited window of opportunity in which we can get in front of the curve and be aggressive in lessening the impact on our community. But it really takes everyone doing our part. It's vital that we each limit our trips into public places for only necessary things, such as accessing health care, going to the pharmacy, or work. I would encourage you to take advantage of any free curbside deliveries, drive-up food service, things like that, but please stay home if you're sick. Also, a direct message to employers: it's important that you don't hinder your employees' ability to stay home when they're sick. Public health or a healthcare provider may instruct your employee to self-quarantine based on symptoms, and it's important to allow that employee to be able to do that. It's absolutely necessary to continue to isolate potentially infectious people so there is no chance of widespread community exposure. With testing resources being limited, these are the most valuable tools we have: quarantine, isolation, and social distancing. But this only works if we're all on board. If you look at Hong Kong and Singapore, their trajectory of disease outbreak was much slower than Italy and Spain and China. And this has been attributed to strict adherence to quarantine instructions by their medical provider or public health, cancellation of school and large events, and then community compliance with social distancing. Going outside, riding bikes, taking walks, and being in nature away from public is all acceptable. Please choose these activities rather than going to public places. We will get through this. We are all in this together.
Very good. So we're going to have a brief question and answer. And so I'm going to ask Mr. Holland.
We're going to take just a second. Let me just brief them really quickly, if that's okay.
That's good with me.
Okay. As Mr. Holland gets up here, first off, thank you. I know this is a lot of time to take, but this is a lot of good information, and you may not have one question because it's all been covered. But if we could just limit the questions for one at a time per group, that would be great. So, that's all y'all.
I'll ask Dr. Wiley to scoot over about 6 feet here, and I'll try to squeeze in here on the end and help address any questions that people may have.
I don't want to knock on this really nice sign.
I guess I'll start with you, Mr. Holland. The biggest question we're getting from people out there is, do you have such a thing as a COVID unit at Hendrick or any of the hospitals here in town? And if so, how many are in there already? If there are people waiting, even though they've been tested, there's no official results, do you have people in there that you believe might have this that you're in?
Yeah, great question. So if you go back to the flywheel there, the last one says designated inpatient unit. And so we believe that specialty trained nurses, that if you are able to consolidate the care into one unit, you have less ability to infect others, would be the best practice, and that's what we're seeing across the country. So Hendrick has designated a unit that would be used for medical appropriate patients. At this point in time, there is a unit that is designated for that, and there are patients in that unit that meet the very, very strict admission criteria. What I can't stress enough is that it is precautionary, because at this point there is no confirmed cases. So out of an abundance of caution, we're using a designated unit with all the appropriate personal protective equipment and resources to keep our patients as well as our employees safe in this uncertain time. So in summary, yes, there is a designated unit, which we believe is best practice, and today we ebb and flow. Patients are in and out of that designated unit, but it's less than 10 at this point in time.
And can you tell me how many total bed capacity you have for that unit, and follow up with maybe total capacity of your own entire hospital?
Yeah, so the total bed capacity for that unit, I believe, is somewhere around 24. It's definitely a lot more than what we're using it for. The total hospital bed capacity is well over 500, but the available beds that are staffed and ready to go is significantly less than that. However, the governor just declared an emergency declaration that allows hospitals to double up for surge capacity. So traditionally, if you had a private room, the governor's declaration actually allows us to put 2 patients in one room, where historically that was against the rules, if you will, according to state regulations. So that surge capacity, if appropriate, gives us a little bit more operating capacity than we used to have. We have not identified how much more surge capacity that is, but it's significant. And we believe that before we would use external surge capacity, it makes more sense to use internal surge capacity where appropriate.
Are you optimistic that this will all blow over pretty soon?
I believe I'm optimistic. My wife says I'm more of a realist. But from an optimism perspective, I think we're all optimistic. I hope that there's a vaccine that's available in 2 weeks. I don't think that's likely, and I believe that in 2 months this will, I hate to use the word blow over, but you hear about a wave. I do believe that the wave will wash through Texas, and we will be on the other side of the wave in 2 months, without a doubt.
I don't know who best to address this to, but let's talk about the frustration of the limited amount of testing and how that frustrates y'all, and how it's not just a Abilene problem, it's a nationwide problem.
Yeah, I'll address it just as a start and welcome that. This is one of the things that I'm excited about our what we call our COVID-19 screening and treatment flywheel. The fact is, if we had the ability to identify testing within 45 minutes to 2 hours real time, like you can strep or the flu, we could clearly fight and identify and have significant impact in real time to be in control of our own destiny, if you will. At this point, when you're not able to identify and just send people home and self-quarantine, you're really kind of fighting the fight with one arm behind your back. Now, we are fighting that fight with one arm behind our back better than just about any community I've ever talked to. However, it is a fight that you're incredibly hindered by. So there is a level of frustration, but at this point, I don't see anybody in this panel dwelling on that frustration. We just look forward to solutions and how we're going to be better in the future than we are today. And so I don't really dwell on the frustration. We just look for how to deal in today's environment. And I open that up to anybody else to address otherwise.
Well, I would say, and y'all may have more, but when you hear somebody who says we're doing testing in our office right now, well, that testing is actually still going to a reference lab, whether it's Austin, Tarrant County, CPL, LabCorp. There is, at this time, today, no ability to do testing in Abilene, Texas. Both Abilene Regional, Hendricks, the local community is working hard to get that testing here. It is still being referenced out. I can swab your nose as a physician. I can put it in a tube. I can put it in immediate. But it is going to a lab that's outside of Abilene at this time. That may change in the near future, but right now supplies is being diverted to high-risk areas. Abilene is still considered a low-risk area. That does not mean that we don't need to be proactive out in front of this wave. That is not the message I want sent. The thing is, these tests are going to your New York Cities, to your Houstons, to your Dallases, to your Californias, Washington. So you have to understand, some of those things are beyond our control. Just like Annette was saying, some of these things are out of our control. One hand behind our back, we want to test patients, but we're still moving ahead, treating patients like, yes, you possibly have COVID, and we're going to manage you just like that.
And I think the other thing to keep in mind too is that when you have a virus that you don't necessarily have a treatment for, the purpose of testing is really just to identify how the disease is moving through a population and identifying it in your community. When you don't have the ability to test enough people, that's where you get into these community mitigation efforts, which is treating everybody as if they're infectious. Everybody stay away from each other. So that's what's important about these community-wide efforts, is that we don't have enough to identify the specific infectious people, but let's assume that we're all infectious and take those precautions.
What's been the turnaround time on testing? Obviously, we have a number pending, so it seems to be sort of curtailed. Not curtailed necessarily, but I mean, it's just taking a while to get results.
So it should be important to note that that 90 number is the amount of tests that have been pending since the beginning of commercial lab testing. Yeah, so some of those tests were submitted yesterday. Some of those tests were submitted 2 weeks ago. So it's not that 90 tests from the very beginning are still pending. Like we mentioned, it does depend on the lab that it's sent to. If it's sent to a public health lab, we usually get a turnaround time between 1 and 2 days. If it's sent to a commercial lab, average, it should be 3 to 4 days, but it can take up to a week. So it really just depends on where that specimen is sent to.
Anything else? Is there anything else any of y'all would like to address that you thought of that you want to say now? Okay, that's it. That concludes it. Thank you guys for being here.
Thanks, everybody.
Appreciate you.
I know.